not a medical doctor, and this information is for educational purposes, not medical advice. Today, we are going to talk about co-occurring mental health disorders that are often seen with anorexia and why they occur. Anorexia nervosa is rarely an isolated condition. It frequently coexists with other mental health disorders due to shared biological, psychological, and environmental risk factors. These co-occurring disorders, also known as comorbidities, can exacerbate the severity of anorexia and complicate treatment. The primary co-occurring disorders include depression and why. Starvation depletes serotonin and dopamine, neurotransmitters that regulate mood, leading to depressive symptoms. Chronic stress from body image issues and social isolation also contributes. Genetic predisposition to mood disorders increases risk anxiety disorders. Why? Heightened cortisol levels from starvation stress the hypothalamic pituitary adrenal axis, triggering anxiety. Perfectionism and fear of judgment, common in anorexia, often predate or worsen the disorder. Obsessive-compulsive disorder, the rigid control over food intake and rituals. Mirror OCD behaviors. Shared neurological pathways, particularly in the frontal cortex, suggest a genetic or developmental link. Post-traumatic stress disorder, trauma can trigger anorexia as a coping mechanism, with starvation serving as a way to regain control. The HPA axis dysregulation in both conditions reinforces this connection. Substance use disorders. Why? Some individuals use alcohol or drugs to manage anxiety or suppress appetite, a behavior that may stem from the same underlying impulsivity or emotional dysregulation seen in anorexia. These disorders often arise or intensify due to the physiological stress of starvation, which alters brain chemistry, and the psychological burden of distorted body image, societal pressure, and isolation. Symptoms to look out for: depression, persistent sadness, loss of interest in activities, fatigue, sleep disturbances, and suicidal thoughts. Anxiety disorders, excessive worry, restlessness, panic attacks, avoidance of social situations, and physical signs like rapid heartbeat or sweating. OCD, repetitive thoughts, compulsive behaviors, and distress if rituals are disrupted. PTSD, flashbacks, nightmares, hypervigilance, and emotional numbness, often tied to a specific traumatic event. Substance use disorders, increased tolerance, withdrawal symptoms, neglecting responsibilities, and secretive behavior around substance use. These symptoms may overlap with anorexia, making differential diagnosis challenging but essential. Here's the prevalence of co-occurring mental health disorders. Depression affects 50 to 70% of individuals with anorexia, with lifetime rates potentially higher due to chronic illness stress. Anxiety disorders, present in 40 to 60% of cases, with social anxiety being particularly common. OCD occurs in 20 to 30% of individuals, with some studies suggesting a higher overlap in restricting type anorexia. PTSD, estimated at 10 to 20%, with higher rates among those with a history of trauma. Substance use disorders affects 12 to 18% of individuals, more common in the binge eating, purging subtype. These figures are based on clinical studies and may vary depending on age, duration of anorexia, and access to diagnosis. The high comorbidity rates underscore the need for integrated treatment approaches. Co-occurring disorders can significantly complicate anorexia recovery in several ways. Emotional overload. Depression or anxiety can sap motivation, making nutritional rehabilitation feel overwhelming. For example, social anxiety may prevent attendance at therapy or support groups. Behavioral interference. OCD rituals or substance use can undermine weight restoration efforts, prolonging physical recovery. Treatment resistance. PTSD, flashbacks, or depressive episodes may reduce engagement with psychotherapy, with studies noting 30 to 50% relapse rates partly due to untreated comorbidities. Physical impact. Substance use can worsen organ damage, while anxiety-driven overexercise can delay muscle and bone recovery. Cycle reinforcement. Each disorder can reinforce the others. For example, depression may deepen food restriction, which worsens anxiety, creating a vicious cycle. Addressing these comorbidities alongside anorexia is critical, as untreated mental health issues can increase the mortality risk and hinder long-term recovery. Effective coping strategies can help manage co-occurring disorders and support anorexia recovery. Mindfulness and relaxation techniques, deep breathing, meditation, or progressive muscle relaxation can reduce anxiety and depressive thoughts. Studies suggest 20 to 30 minutes daily can lower cortisol levels. Cognitive behavioral therapy targets distorted thoughts in both anorexia and comorbidities like OCD or depression, with evidence of 40 to 60% symptom reduction in controlled trials. Support groups. Peer support can alleviate isolation, especially for those with social anxiety or PTSD. Structured routines. Setting small, achievable goals can counter OCD rigidity and build confidence, reducing relapse risk. Professional help. Therapy or medication, under a psychiatrist's guidance, can address specific disorders. Certain foods can support brain health and alleviate symptoms of co-occurring disorders. Complementing recovery, omega-3 fatty acids reduce inflammation and boost serotonin, potentially easing depression and anxiety. Studies link 1 to 2 grams daily to a 20 to 30% mood improvement in mood disorders. Complex carbohydrates stabilize blood sugar, supporting concentration and reducing irritability linked to anxiety or OCD. Vitamin B-rich foods support neurotransmitter production, aiding memory and mood stability with deficiencies common in anorexia. Magnesium calms the nervous system, reducing anxiety and PTSD symptoms with a recommended 300 to 400 milligrams daily. Probiotics improve gut-brain communication, potentially lowering depressive symptoms, as emerging research suggests a 15 to 20% mood lift with regular intake. Thank you for coming back to my channel and choosing to learn more. I appreciate you being here. Take care and bye for now.